As long as we're looking after you as the whole person, treating you specifically, what technique or what skill doesn't matter as long as it's the right thing.
We're not, as a disclaimer, we're not here to discourage people from seeing a chiro or seeing their chiro or whatever works for them. It's definitely not a forcing people to come here or, go see anyone. It's just an education form to just give a list of what chiros actually are.
You are listening to the Movement Therapy Podcast.
Hello, welcome back to another episode of the Movement Therapy Podcast. We're back for part 2 with Andrew. Thanks for joining us again.
No worries.
A bit colder this morning. But last episode we talked about essentially where physio, chiro, osteo came from, the history behind it, the professional sort of philosophies and where sort of we've been going wrong in Western culture as to sort of which ones, what the stereotypes are and we sort of break them down. Today we're going to get a little bit more sort of personal with you, Andrew. We're going to look at sort of, how you became a chiro and an EP and where sort of that went off and go, hopefully a little bit deeper into you as a clinician. Mm-hmm. But first, I want to lighten the mood a little bit. I want to get into your obsession with orangutans.
Okay. We'll call it obsession. Well, firstly, why wouldn't you?
Oh, exactly. That's it, done.
That's it, answer done. Short answer, sweet. Oh, no, they're just awesome. I don't even know why.
So where did it start? What was it?
I think they're the coolest animal. Maybe I look like one, I don't know.
I think that's what someone upstairs said.
I don't know. I think they're very cool. They're a bit, not mythical, but there's only a small area in the world where they come from. You can't just see them anywhere.
Yeah, cool.
I think that they're cool in that regard. They're very human-like in some of their actions. So they're smart. I was just telling a story before we recorded. Like, I've been in a zoo playing a hand-on-hand game with them, and they're emotionally intelligent. And I don't know.
And was that a wild one, or was that sort of Are they in?
That was in a Bali zoo, and
right.
It looked. I mean, it didn't look like it was treated poorly. Like sometimes these things can be bad, but it looked like it was having a lot of fun.
Yeah.
They look like they're always having fun, and I'm always up for that. So I think they're just a fun-loving animal. It looks like they break down the barriers that we have as humans, and
that's cool.
They
just don't care.
They just get to eat all day long, swing between the trees.
Dream. What would you want?
So talk about is spirit animal or is it the animal you want to be?
I don't know. Maybe it's a bit of both.
Oh, that's so good.
But I don't know. They're cool. They're the cutest little babies, and they turn into this massive.
Zoe showed you a video of one driving a golf cart. The first thing he said was, "How fat is he?" I love that. What's your spirit animal?
When I was a kid, I wanted to grow up and be a Dalmatian.
Oh, nice.
Like that was
not just a dog. It had to be a Dalmatian.
I really wanted to be a Dalmatian when I grew up. But now I don't know. I really, love all of them.
Yeah, sweet. Yeah, that's cool. It's interesting having the chat and people just throw like orangutan. It's like such things you wouldn't even think about. No, that's not. All right, let's get back on topic, shall we? I actually forgot. I had to look at my list. What are we talking about? Okay, first of all, which one came first, EP or chiro for you, and why both?
EP first.
Yep.
Start exercise science. With the intent that I didn't want to be in a clinic. The idea was like, I want to be in a gym environment, sporting environment, probably like most people, in both EP.
I like sports, so I'm going to go into physio or EP. Yeah.
With the intent of never going and doing more of the rehab side, I like the exercise component. I grew up injured like everyone else. But I liked the exercising component and thought that was going to be the way forward.
Yeah.
Worked in a gym, and I went to that gym because I could specifically be accredited. So now as an EP it's a bit different. It's changed since I went through. It's had many variations of how that degree and the rehab, the next part up with the either built-in rehab component to the course or going and doing further training. So the way I did it back then, undergraduate, my first official boss, all he had to do to be accredited was essentially just write a document, say this is what I'd done.
Yeah, right.
I'd been traveling and missed out on that, and I had to go get a job to get my accreditation.
Wow.
So luckily I went to a job that got paid, did that. I got to see a huge variety of clientele because I was doing both personal training and EP work, so exercise rehab work, in both cardiac rehab, musculoskeletal health, cardiorespiratory, that sort of stuff. So
and we do discuss the difference between PT and EP in our EP episode with Liam and Luke a couple of weeks ago.
Yeah, so this is the type of setting that I did both and got accredited, went and worked for one of my mates who went to uni with, and we were in a very, very heavy exercise physiology based clinic, or went around to multiple gyms and clinics. And then I quickly fell in love with the rehab side of things. So I very quickly went, okay, I really like the why behind things. You and I chatted about this all the time. We think very similar. I had to know, well, why is this happening? And I got very quickly frustrated with I've done the physio, chiro, osteo, massage, acupuncture. I've done all the passive care stuff, and now I'm here to see you. I'm like, yeah, but you need that stuff. I'm like, yeah, but I've done that and didn't work. And I'm like, well, that doesn't gel with me. That didn't sit right. And so I started to go, well, why isn't it working? So then I needed diagnostics. As an exercise physiologist, we're not really trained well enough in diagnostics, but you're expected to know to treat that diagnosis, even though you don't know how to perform the diagnosis.
Yeah.
And that's something I think that's really challenging in the EP world, because you might be treating someone with a lumbar disc herniation, but you don't know how to diagnose that lumbar disc herniation. So how do you know if it's getting better or worse? And so that really frustrated me. That drove me to then seek out people. So I sought out a lot of chiros, osteos, physios, other strength and conditioning coaches, GPs. I worked a lot with a lot of people. I hung around them like a bad smell, just constantly, can I come and watch? Can I come learn? So that was really good for relationships with these people. And they would refer to me and I'd refer to them. And so I developed a lot of almost like friends, but also colleagues within different professions. Because I think I remember being at uni and being told, don't refer to chiros. But I would see these chiros and I was like, these guys are doing really cool stuff.
Yeah.
And I worked closely with an osteopath, and she kind of went, I think you need to go study. I worked very closely with the chiro. He's like, I think you need to go do this. And I was like, okay, I want to go on this path. I was very intrigued and interested in the rehab side of things, and sought out SFMA, or functional movement systems, which we use here, and DNS. And DNS really drove my passion to rehab and the understanding of the body. And in Australia, DNS was heavily brought into the country by chiropractors. So like the chiropractors who sort of ran the Chiropractic Association or ran education were bringing these DNS practitioners who were physios. And these physios in the Prague school were going, this is all chiros. What's the thing here? So that drove me to go, well, why is it the chiropractic profession that really likes this rehab process, this DNS, dynamic neuromuscular stabilization, and there wasn't many physios involved? So that led me to go, okay, well, I've got a decision to make. I can either go do a physio, chiro, osteo sort of degree. I was working with GPs that would say, and I'd say, oh, can you send this patient to a chiro? And they go, no. And that was it. Flat out, no. They go, well, why not? No answer, crickets. And so that made me go, well, why not chiro? And then I said, oh, well, what about an osteo? And they thought about it and I went, okay, so there's something there, there's an emotional thing here. Physio, sure. Okay, so why? And they couldn't give me an answer. So that drove me to go, okay, I need to seek these out. So I went and sought different practitioners. And with the chiros, as I said, there was very heavily DNS, which I wanted to do. The SFMA or FMS model, a lot of chiros and physios would do. And osteos. And I wanted the tools to be able to do all of it. And so that kind of led me to go, well, I know chiros and osteos can do the rehab like a physio, and they can be manipulative in terms of their skills.
Not as people.
Just to clarify.
I mean, some people maybe.
Manipulation as a tool. And I was like, okay, that's a good tool. And all three professions could go study DNS and
that wasn't restricted.
So part of my goal to go to do a medical-based degree like chiro, physio, osteo was I want to study further along the medical path of DNS. So that was my main driver. I was like, I want to do DNS more, and I want to use that model because that model encompasses how we look at the body. So down to two options. Osteo was not a very good option here because it wasn't in Sydney anymore. I had to travel. That was not going to be an option for me. So it was chiro or physio. Both were going to be a 3-year plan for me. And chiro to me was like, okay, there's this weird, people don't like it, people love it.
Because that was even then when you went to study, people didn't like it. And it was,
absolutely. People are like, why are you going to do this? I was like, well, I need to know. Part of me, I was like, I need to know why people are flat out blindly refusing this degree, this pathway, and having no idea why. Like that, I was like,
no
there's something to
explanation.
this. They couldn't tell me. very, very, very smart people that will just blindly emotionally know. Like, that's not a good answer.
Yeah.
So I was like, I got to study it myself. Plus,
That's awesome.
It's aligned with DNS. Plus, it gives me the skills. And I say this a lot, like the degree is insanely complete in Australia with what we get given as a list of courses, a totality of education is phenomenal, and people have no idea, unfortunately. Yeah, so that led me to Chiro. So then I was like, well, now I'm dual trained Chiro and EP. I've got the rehab, which classically Chiro isn't given.
Isn't known,
I would push back on that. And the Chiro rehab that we were given at Macquarie University was phenomenal.
Yeah.
I had students with me, colleagues that were going, oh, whatever, you know. And I'm like, you guys don't understand. When you get out, this is going to serve you a lot because you can't just crack everything away.
Yeah.
I said, I've done this as an EP, and this is really good training. And so hats off to the Chiro department there that they've really put good rehab process in. Because we know that you can't just crack things away and expect to be done with it.
Yeah, 100%.
Yeah.
What, with that, when you started to become a chiro and you started to work clinically, what was the biggest sort of misconception that you thought people had about you? What was the main sort of thing that when people came to you that were a bit skeptical, what was the main issue with you being a chiro?
I think the biggest first thing is fear.
Yeah.
They don't know what it is.
Yeah.
And I can agree with that because they're going, well, what are you going to do? And it's because they're putting their body in your hands, literally. They are like, what's this going to do?
Yeah.
And I think the fear is probably the biggest one. Secondarily is you're just cracking something.
Yeah.
And
there's a passiveness about a physio or an osteo that's going to be gentle and slow and not quick. And I think with the fear thing, there is that, you're putting your body into a position that is very vulnerable and then you're moving it really quickly. Yeah. There's a fear there because there's a vulnerability.
I think that's probably the biggest one.
Yeah.
I don't see many. Like I'd seen a few patients that like they didn't realize I went to uni and got a master's degree in chiro. Because that comes from the old school where it was a college-based education in America. But it's a master's degree. It's a high level.
It's higher than physio, but a bachelor physio degree that I've got.
But I've had patients that go, "Oh, did you go to uni for this?" I was like, okay. So I think it's fear. But then I also had people that would have seen me and didn't know that I was one or the other.
Yeah.
They would go, "Oh, are you a chiro?"
Yeah.
Or they'd go, "Oh, you an EP?" Like they didn't realize.
Yeah.
And then I still now every week would get someone that says, "What are you? Like, are you a chiro, physio, osteo?" I'm like, it doesn't matter.
Yeah.
As long as we're looking after you as the whole person, treating you specifically, what technique or what skill doesn't matter as long as it's the right thing for you.
Do you ever find the inverse of the usual, hesitation about chiro? Do you ever find when someone sees you as a chiro, they're a bit hesitant about the EP side of it at all?
If they're the type of person that comes in and don't give me exercise. Don't give me stretches. I want to hear that, they're that type of person. So we do get a lot of those people and they're classically, and I'll have to try and write them too, where they'll say, "Oh, physio doesn't work for me." Or stretching doesn't work for me, or what, and they label something. Again, they're doing the same thing that what everyone does to chiros.
Yeah.
It's that didn't work. I'm like, well, maybe that particular time, that particular person, that whatever. It's like you can't just put a whole profession down that says,
exactly.
"Oh, it doesn't work." It's like, oh, obviously it works, but So I think there are times of that. It's less. It's definitely less. But there are the person that's like, I didn't hear the big crack. Like I want that.
Yeah. It is funny when you say that because I get a lot of clients that do come in and say, "Oh, physio didn't work." They don't know what I am, and they come and see me, and we do a full assessment, and then they go, "Oh, this is what I need. This is what I'm missing." And then I say, "I'm a physio."
Must work for you now.
And it's like, "Oh no, belief changed."
So many, it's not probably every week, but it's a lot.
It's pretty regular.
I don't know. I don't like those chiros. I'm like, has anyone told you that I'm a chiro? But it doesn't matter.
Yeah, no, 100%. What's the education? How deep do you go to that with people who are skeptical when they come in and see you? Is it straight away? Are you a person that gets defensive, as probably I would be if someone questioned my profession?
I don't know. I'd have to get probably someone to ask
Yeah, that's a
put
good
me in the
point.
place and see where I am. I don't think I'm defensive. I'm probably I want to stand up for what's right, and so I've had people.
Yeah.
I particularly would remember one patient. And she said, "Oh," and I was actually going to do a lumbar, a low back mobilization manipulation on her, and I said, "Did all the classic, is this okay? This is where things are good. This is where potentially things go wrong. You do your classic check that everything's okay." And she was hesitant. I said, "Oh, I don't have to do it. I've got other tools. Like, what do you want me to do?" And she said, "Oh, I said, "What's wrong?" And she said, I don't know if you're trained in this." I went, "Oh, okay." And she goes, "I don't mean to offend you." I said, "I'm not offended. I want to know what you're saying.
Awesome.
I want to know." I said, I'm greatly intrigued and interested. What do you mean?" She said, "Well, I think the physios are trained in this and the chiros aren't." I went, "Oh." And she went, "Oh, I've offended you." I said, No. I'm so intrigued to hear where you think this has come from."
Yeah.
I said, "Because it's the exact opposite." And she said, "What do you mean?" I said, "Go ask your physio how many hours they get in this technique. They get 1 shoot and 1 hour lecture."
And only thoracic spine.
Yeah. And she went, "What?" I said, "Do you know how many thousands of hours I did in this?" And she was like, "Really?" I went, "Yeah." And I said, and I was still early, like I was still continuously early career. And I was like, and I'm still practicing this every day. But we had so many hours practicing this. And she was like, "Oh." I said, "Where did you get this belief from?" She said, "I don't know." I said, This is partly why I went and studied it, because people come and have this opinion, and it's based off literal, like fictional, like it's not true." And she was like, "Oh." I said, "I'm not offended at all." I said, "I actually really appreciate you telling me this, because this is what we're going to fix. Like, this is a problem in the health profession that." One, you thought I was not even trained in something, and I'm like, "Hey, that's fine. I can show you how we are." But I really wanted to educate that and just say, "Look, this is where it comes from." There's a problem there that people believe something that is totally false. But,
And I think this is why we're doing the podcast. Because we're not, as a disclaimer, we're not here to discourage people from seeing a chiro or seeing their chiro or whatever works for them. It's definitely not a forcing people to come here or go see anyone. It's just an education form to just give a list of what chiros actually are, what they do.
It's a lot of confusion.
Break down some fear. And I think without throwing you under the bus, though, it's a way to bring in, the general population and to be someone who isn't trained in the health sector, who has these little beliefs potentially, to actually break down some of the beliefs and fear, which is definitely
I've definitely shone a new light on chiros for me, which is good. But I think that's an important way to approach it, not as a dismissive or like getting offended, because it's not like a personal attack on you. It's just more of like
just a belief.
A belief and an education of what people know. Because even like preparing for this and our past episode, I was like, I wasn't talked to Darby, but
we love talking to each other. We're going into personal here now. I did say.
No, but it was more like I have this or had this belief about chiros, and I even thinking about it, I was like, well, why? It's not like I've sat down and looked through research and that kind of stuff. I haven't gone through anything. It's just been off what I've heard from other people who are in the healthcare professions, and it's just kind of how I've come into it from there. It's not, I've never seen a chiro before. It's nothing like that. It's just, what I've heard from people, and also what you see online and that.
Of course.
That's it. Yeah, that's the media. Which we talked about last week. And I think as a professional, I was the same. Even it wasn't taught at uni, but it was implied that chiropractor wasn't a legitimate profession. It's you're a physio. Or you're not. And for the first sort of 3 or 4 years of my career, I thought that, and I treated it as such, and I would shun patients who did go to chiros, and my friends from home that would go and get their neck crack every month, and sort of I'd be, they don't even go to uni, they're useless. And then I lived with a podiatrist, who he taught me essentially. I don't even know where sort of his knowledge came from, but
he got taught by chiropractic.
That correct. Yes. So, and it was the breakdown of the question of going, well, why? Why do you think they are like you said? And I couldn't answer it because I didn't know. I just went ignorant. And
I think that's where a lot of this issue comes from, is people have this belief or previous fear, or someone's told them, but they never stop to think, actually, why do I even have this? And And you don't even necessarily have to go get treated by it. You could just say, tell me what you do. Like, you know, like, this is like, there's weird times where I'll go to a house party or meet someone in the park or whatever. I'm at some gathering and they're like, what do you do? I'm like, oh, I'm a chiropractor. And sometimes I'm sitting there thinking, oh, here we go. I just sort of get a read of the person and I have this expectation it's going to be like this side of the fence or this side of the fence. The person just go, bleh. Or they have this, got this neck. Man, I'd love to get your
Can you have a look at my neck?
Tap my neck right here. I'm like, no. That's this just dichotomous view. It's always like, oh, I hate them or I love them. It's just never like, oh yeah, what is that? It's
They've already got a preconceived notion of what it is. Yeah.
Classic.
I've got a couple of examples for you, real life examples here. So this is crazy because this approached me,
it's not crazy.
No, it's exactly what it is. Yeah. So my client came in. It was after our first recording for first episode. Yep. He came in to me the next week. It was very fortuitous. Yeah. So this client presented with just left hip clicking. It wasn't really pain. It was just his left hip clicked when he walked upstairs. Mm-hmm. And this had happened from when he was 13 or around, being a teenager. And he said it happened pretty much his whole life. And then he gets on and off low back pain, which is aggravated by running. He wanted to run. He tried to run a couple of years ago and it didn't work. Sometimes he gets symptoms down the leg. This is not a weird presenting condition. We get this stuff all the time. Yeah. So he presented to me with this. I found out that he'd be going to a local chiro for about 9 months, right? This is what we classically term as a high volume chiropractor, where they go in for about 5-10 minutes as their appointment. Yeah. Initially it's twice a week, then it goes to weekly, then monthly. He's on fortnightly at the moment, fortnightly visits. Yeah. I can't confirm, I can't remember if he said he paid as a package or if he pays per thing. I can't quite remember that. Yeah. But he got x-rays. So he got an x-ray of his neck, he got an x-ray of his whole spine. Yeah. And posture photos where he stands next to a plumb line, so that vertical line, and see, which direction he's in and whatnot. Yeah. As a sort of number one, he hasn't got any improvement in symptoms for that 9 months. Yeah. He showed me the x-rays pre and post. So I think he did one initially, then 6 months, and he's got another set coming up in a couple of weeks. Yeah. I couldn't tell the difference between pre and post for either x-ray or posture. I said, don't tell me, let me guess, because I want to see if there's improvement. Yeah. I picked wrong. So it's not that I couldn't guess right. I literally thought that the better one was his baseline. Yeah. And he was so surprised. He was shocked that, there wasn't a benefit. Yeah. And he was looking at the same pictures that I was, but it's the belief systems that was challenged here. Yeah. And the second thing, again, I don't want to throw sort of these chiros under the bus because like we talked about last week, they do have a benefit for us. There's just needs to be that understanding, and we'll get to sort of your opinions in a sec. Yeah. The exercise that was given to him was he had to stand up. He had his arms, I believe, together pushing, and he had to twist 200 times every morning. Yeah. Slowly. The next one, he had to hold a spinal extension, so leaning backwards when you're standing, and he had to hold that for 2 minutes with different arm positions. So one with his arms out, one with his arms at 90 degrees, and I think one with his arms down by his side, but I can't remember. But 2 minute holds each of those positions. Yeah. And then the third one was a neck movement hold. So turn his neck to the side, hold for 2 minutes, or that was 30 seconds, I think. So there were these 3 exercises. Yeah. What would you tell a patient, or how would you approach a patient like this? What would be your sort of go-to? Because he didn't come in with my chiro's a quack and, I'm not getting any better. He came to me wanting a second opinion of just going, my wife's seen you guys. I want to actually see if this is, working. How would you approach that?
Yeah. So I think we're always looking at the goal of the patient. Yep. So we have to take that in consideration. I think we're very heavy as a society, indoctrinated, trained to think, fix my pain. Mm-hmm. That can sometimes be very, very easy and sometimes be very, very hard. And there's a huge spectrum in the middle. What we often miss or forget is that we want to treat function. And one way you could argue is like, well, if I treat function, theoretically, I will address pain. But that doesn't always occur. Yeah. But that would be one thing. Is like, I'm trying to address your function to achieve your goal. And that's where I think if we think dogmatically, diplomatically, look at this on like, okay, there's an upcoming election, you know, which side,
Which way do you fall?
Yeah. So I think I think you have to be able to answer this and not throw someone or a profession, something under the bus, and just go, again, do the why.
Yeah.
So I think we have to do the same thing that we're asking our clientele to ask. Well, what is this thing about chiros? We have to now say, well, what is this about your goal? You know. So I think one, just, okay, are you happy with the treatment? If not, regardless of profession, what are you not happy with? So if the person says, well, nothing's actually addressed my problem, you go, okay, well, let's address your problem.
Yeah.
Let's see if I can have a different excuse, different answer here to what's going on. So if you came at it with a completely different rationale and the patient goes, oh, that was great.
Yeah.
You go, cool. It doesn't matter whether it's a chiro, physio, osteo, exercise physiologist, massage therapist, acupuncturist, doesn't matter.
Yeah.
Then you just go, okay, the other person missed that.
Yeah.
Let's just address it, move on.
Yeah.
If the person's happy with their treatment, it's like, I feel good when I leave, you go, okay, cool. Is it offering an answer to your goal that you want? And if they say no, it's like, okay, well, now we have to think about how do you go and approach this practitioner and say, hey, I need you to address this.
Yeah.
Because I never want to tell a patient, don't see them. I'll never do that.
Yeah.
I'm not going to say, don't see that person. I'm going to go and ask them, hey, go and ask that practitioner, what are they trying to do for you? Because this practitioner, this chiro might have gone, well, you know what? I truly believe that I'm going to adjust this person's spine and it's going to make it straight up on that x-ray.
Yeah.
I doubt it's going to happen.
I'll say with these x-rays, obviously, that they get the lines and they look at it.
Yeah.
So one of them is pelvic height.
Yeah.
So they draw a line between what they call the iliac crest, so your hip, essentially your waist.
Yeah.
The line on the x-ray, one of the iliac crests wasn't actually shown.
Yeah.
So the line just goes into blackness, and then there's a green line that lifts above it, that where it should be.
Yeah.
And it's not even based off an x-ray that is visible. They're completely guessing, but the line couldn't even be a millimeter apart from the normal line.
This is a big change in healthcare, Medicare in Australia, chiropractic as well. So chiros, we've always been trained to take x-rays. So I was trained to take x-rays. I don't know if this will always continue, but besides a radiographer and a chiropractor, no one else can take x-rays.
Yeah.
So we're trained to do it. Back in the day, every chiro would, well, not every, but a lot of them would have their own x-ray machine. Yeah. And so the clinic would have to have, you know,
the lead walls and all that,
sort of stuff. And old clinics, you'd see x-ray boxes everywhere.
Yeah.
You don't see that anymore.
No.
Like our clinics, because one, we're not given personalized x-ray handouts anymore.
Yeah,
it's
true.
Online. So that's all changing. Medicare a few years back was, for whatever reasons, not happy paying for these x-rays that are clinically not necessarily relevant, which you'd argue in this case, because you can't see a difference.
100%.
So that stopped rebates for x-rays.
Yeah.
So that meant, okay, well, I'm not going to go get a rebate going to a radiographer, but the chiropractor could still take an x-ray.
Yeah.
And so they use that as a tool because that's based off a long time ago, hundreds of years ago. That's what was used to help diagnose a bone out of place model.
Yeah.
Since then, we know that it's not necessarily an idealistic view of the body.
Yeah.
But some people still do it.
Yeah.
So you can't just run your diagnosis of an x-ray. You know, that's, even if that's a pathology, you still have to match up to their history and symptoms and do tests and so that sort of stuff. So I'd say, don't disregard the x-ray, but say, okay, look, this is not level. Like, you were able to clearly see that this is not a levelized x-ray in the first place. Let's not base your treatment off this. But I would still this person, if they came to me, I'd say, okay, well, is your symptoms being addressed? No. Okay, well, let's give a way of addressing this. Yeah. It might still mean manipulation. It might still mean exercises that, like, I can't, like, sort of discuss whether these exercises are right or wrong. But if they're not working, it's like, well, let's find a different approach. Yeah. And if the person then says, oh, this is good, I'm getting my goals, I'm like, okay, cool. Yeah. You move on. Yeah. It's hard to say that, oh, that's the wrong exercise or that's the right exercise without knowing the patient in front of you. But I think at the same time, if we look at the way the body works, you know, they say there's things in life, there's death and taxes. Lots of people are trying to, you know, get around the whole death thing.
They're trying to avoid both, really.
There are avoiding taxes. But the other things that we always have to consider, we're always got to consider physiology. And so with that, There's always biology and there's always physics. We've
Yep.
always got gravity on us.
Yep.
There's always our biological systems in place. And so with that, there's always air. So there's gases in our body and there is gravity. So
Yep.
if an exercise addresses that or a treatment addresses that, then great.
Yeah.
And you and I have this discussion all the time. Like,
Yeah.
what are you trying to address? Like, that crack that a chiro gives is a very physiological phenomenon. For someone to say that doesn't work, I'm like, that's
Yeah.
like saying, like, I don't even know what it's like saying. It's like the sky isn't blue. It's like, well, obviously it is. It's like the crack does something.
Yeah. Neurologically.
Absolutely.
Has to.
Like, it does
Yeah.
a lot of things,
Yeah.
but it may not do what you think it's doing.
Yeah.
That you have to get back down to the why
Yeah.
again. But it's a very physiological phenomenon. You could have someone's neck that barely moves and then you crack it and suddenly they just go woof.
Yeah.
That might not stick 2 minutes later.
Yeah.
But you change something.
Yeah.
And I think in those sorts of cases where someone's getting the same sort of treatment for 9 months, obviously they're not looking at, well, what's going on physiologically here. I give them a crack, I give it the body an input, a neurological input, but it's not sticking. Maybe that's why there was 200 reps. Maybe that's why there was a designated time, because as soon as you add time to something, you're now changing physiology.
Yeah.
But it obviously wasn't working either. So it's like, you've got to go back to the assessment here. What are we trying to change here? Are we trying to change some sort of neurological phenomenon, or are we trying to change physiological phenomenon?
Yeah.
Because we could just flip this all on its head and just say, if you go to a personal trainer and you say to them, hey, I want you to get me more muscle and be leaner and lose fat. Can you go to that personal trainer once and get all those guys?
Not at all.
Absolutely not.
No.
You would be a fool to think, oh, hey, Steve, I'm going to see you once and you're going to get me ripped.
Yeah.
I'm going to put on 5 kilos of muscle and I'm going to lose 10 kilos of fat. Steve's going to go, okay.
Even like with a once a month or once a fortnight, you're still not going to
gonna
get an adaptation.
Because you're addressing physiology at that
Yeah.
point, right? So we have to put things on this perspective and go, well, what am I actually trying to achieve here? Because if you went to a personal trainer for 9 months and saw them a couple times a week, you'd probably come out with really good goals, really good changes,
be a change,
adaptations,
yeah.
if you were eating right.
Yeah.
So we just have to put things on like, well, where does this stuff sit?
Yeah.
Because if you say physio, chiro, osteo, I want you to fix my back pain, and you see them once and that's it. Good luck expecting anything to change.
Yeah.
Yeah.
Now, if 9 months later and nothing's changed, it's like, hey, we're going to address something different.
Yeah.
It's not working.
Yeah. And this is exactly where sort of we're up to at the moment. I've only seen this client 3 times, I think.
Yeah.
And haven't really broken down his pain at all. His pain's been there since 13. This client is late 30s at the moment. So there's so much time between injury and current that the body has to adapt and learn. So you're not going to change that in a second.
No.
But my approach to that was assessment and going, okay, well, I'm not really going to look directly at the hip now because you've already had that. The chiro was doing that.
Yeah.
Now I need to look at the whole body, and we uncovered a whole bunch of different things. I think you said a really important thing, something that was brought up with Robert Lardner, that when we did the DNS course, was the ability to use the gases of your pressure system, so air inside your lungs, the diaphragm, the intra-abdominal pressure, gravity. If you can control those forces, you go on a hell of a way to control the rest of your body movement.
You're matching the external forces.
Exactly.
I say this to people every day, probably. Like, you can't laugh, cough, sneeze, yawn, go to the toilet.
Yeah.
You can't do these things well
Yeah.
if you're not controlling those internal gases. You don't have internal pressure.
Yeah.
So, like, if you're not regulating that stuff well, which is what we would call here the core, like, if you're not doing that well, good luck trying to fight gravitational pull on you. Good luck sitting at your desk all day with poor management of that stuff.
And the thing, like, gravity doesn't change.
No, that's right.
From morning to nighttime, from day 1 to day 90, or year 97, it's always the same.
Yeah.
So this is where we love, we've gone off topic slightly, but we love strength training for the older population.
Yeah.
To be like, these guys have to be in the gym if you're any person really, just to fight the force of gravity, which does not change.
Yeah.
So we'll get onto that, I think, in another topic, because that's the core sort of breakdown we'll get into as well.
Yeah.
But I think this is a really important example for clients, because I think this happens more often than not,
Of course, absolutely.
getting not sucked in, but I just sort of feeling this chiro model of the high volume, the cracks, and to their credit, they don't know the client doesn't know any different. They're going with their expectation full of going, I'm going to get a crack here, I'm going to feel better,
Yeah.
I'm going to walk out, I'm going to trust this chiro that they're doing the right thing.
Yeah.
whether the chiro thinks they're doing the right thing or not, the patient's expectations are met, and I think that's the difference.
I mean, I see some people as a chiro, so they're seeing me as a chiropractor, and there is not one HVLA, high velocity, low amplitude manipulation
Adjustment, yeah.
It's all either mobilization, or it's stability exercises.
Yeah.
It's done in a way. Now, as long as I meet an expectation, because that person will leave me going, Duff is needed. He doesn't listen to a word I say. They come in expecting a crack, and if I don't give it to them, they're like, dude, where's my adjustment? Now, if I'm sitting there going, well, actually, your body doesn't need it. The joint moves fine. Why would I adjust it? It's okay. You need to learn how to stabilize this thing. Doesn't matter whether I put you in an X-ray every 3 months or not. I see your joint doesn't work the way it's meant to work. Let's address it. But if they're sitting there going, I want to crack. We have to meet each other's expectation. And that's where like the healthcare model really has to address that. Like we have to give them the opportunity to say, this is what I want, their goals. And then I have to be able to go, well, this is health advice. Like I have some people that just go, just absolutely crack everything. I want the whole...
Reset me.
What's his name on in Mel Gibson on the rack machine, Braveheart. Like they just want everything, right? And I go, but that's not healthcare. Like that's that's not addressing your problem. I go, I don't care. Give it to me. And if I don't give it, like they're gonna leave going, you didn't listen. So I've got to meet them and go, let's have a discussion here. Let's educate and let's work out what does your body actually need, because I'll make you feel better that way.
Absolutely.
Where if I go and just succumb to what they want, they'll go, oh, I'm so sore. I'm like, well, duh. Like, I just can't walk out of a football tackle that push you to the ground and get up and go, I feel
fantastic.
It's a big physiological, huge stress to the body that your body's like too much too soon.
It is really funny. I've come to you fairly regularly for my shoulder and other ailments. Sometimes I just want to lie down the bed and just let you do stuff. Like I don't want to do exercise because it's hard.
Just fix me.
Exactly. And it challenges my central nervous system and it makes me exhausted.
That's why there's a massage therapy model.
But I know I need it, obviously, because I have the knowledge. But people who don't, they just go, oh, just fix me. Just give me the, give me the pill.
Just rub, crack, shove a needle in it.
And just make the pain go away. Which, some people think physios do as well. They're just like,
of course.
Lie down the bed, make me feel better. And it's...
Stretch me.
Exactly. That's the expectation. On the sort of parallel pathway to that, obviously we had the client example. I want to talk about a practitioner. So one of my friends in Melbourne who's a very capable and competent physio and has been for many years now, done her master's in pelvic health and going down that route. But she's practiced in Sydney, practiced in Melbourne. I was interested in her take on chiropractors. Being that, highly educated professional living in a big city, and I sort of asked her if she would refer someone with just chronic low back pain, nothing specific, but a patient that we see all the time, chronic low back pain, X plus years, and if she was fully booked, would she refer to a chiropractor in the local area? Essentially, she said no. And I sort of broke that down because I knew she would say no, but I broke that down to sort of the why and what she would rather refer to. And she went straight to osteo, and they have a lot more what they call myotherapists in Victoria, rather than we have in New South Wales. But she was essentially trained a little bit by an osteo. She was, supervised by an osteo, and she was more comfortable with osteopathy model. And she'd much more refer to an osteo. And I kept going the why, and then eventually we started to break down that the fact that she didn't believe that chiropractors understood disease, pathology, physiology generally. And she also didn't believe that chiropractors provided a rehabilitation or, she was saying, oh, this sort of client needed exercise more rather than the passive adjustment theory. So she was definitely going down a high volume, chiro's just crack and that sort of stuff. And she also said that they didn't have a variety of tools. They didn't have enough tools to be able to address the chronic low back pain patient. I sort of want to unleash you here. What would you say to this as a clinician to a clinician?
I guess against the chiros, this is the classic mixers versus straights. So the straights are you adjust, see you later.
Off you go.
If you're lucky, they will get some sort of stretch, mobilization, puts you in some sort of passive.
And people keep going because they make you feel better.
Yeah.
Like they give you a neurological unblock and it's this, I feel great for a day.
It's the fastest, most powerful, very safe tool.
Yeah.
Like if someone was to argue that, I'm like, give me a faster tool.
Yeah.
You can't.
No.
It's the amount of neurological phenomenon that occurs to the whole central nervous system. Good luck finding another tool. There's lots of other powerful tools. A hammer is a very strong tool. It will just have disastrous effects. Yeah.
But
needle,
social media, we've seen that a lot.
a needle is a very powerful tool to the connective tissue in the joint. It's slower. It has risks too. But so this is what's on the front end. There's the mixers versus the straights. The mixers is kind of the new school chiro, if you had to say that, where they are heavily involved with the rehab side of things. Again, this is where DNS, SFMA, FMS, any of these 3, 4, 5-letter brand names.
It's all acronyms.
It's all acronyms everywhere, right? But a lot of these companies are getting a bigger foothold in the industry because we know that as we know more and we learn more, that we have to have input from different physiological, neurological, musculoskeletal, whatever you want to say. We have to have these help. We have to have, other tools involved. So I would say if the chiro, and this could be any profession, this could be you go to a massage therapist and all they ever do is massage with no advice, no education, whatever. It's the same thing. You can go to physio and all they do is a heat pack and an ultrasound, same thing.
Which still exists.
Yeah. Or you go to any profession and all they do is one tool. Then it's the same argument. Now, chiro has been chucked on the bus a lot, maybe because it's highly emotional. It's very easy to attack it. But for whatever reason. But there are some chiros that all they do is adjust and see you later. So hands down, I can't argue with that.
What about the disease and the pathology and the pathophys stuff?
Back on that. I would say if you went, we should do this. We should grab up our the printout sheets of paper of what we studied under the education subjects that we did. The pathophysiology, the neurology, the musculoskeletal care, as I said before, the rehab that we're given as chiros. Now, I can't say for every uni, but Macquarie, it was phenomenal. And I used to work for a lady that she brought out a guy from America who trained under the private school. She physically said, "You're coming to teach rehab at Macquarie University." That was his whole focus. He came to teach rehab at Macquarie. And the rehab there is great. Whether someone uses it or not, I don't know. So that, I can't say. So the pathophysiology that we learn is phenomenal. We were taught by doctors. So I was taught medical doctors who have no foothold in chiropractic whatsoever. They have nothing to do with it. They trained us. We had physios, PhD physios, come and teach us rehab. Now, I'm going to say back to a physio, did you have a PhD physio that taught you rehab? And if they go, no, I'm like, well, this is a moot point. This is a bad argument. If they say, yeah, we did too, I'm like, okay, we're equals. Then what's the problem here? So, I was trained by physios. I was trained by osteos externally. I don't think I had an osteo. Actually, no, I did. I had an osteo at uni because he was trained as both dual chiro osteo, which used to be the fact. So at Macquarie, it used to be a chiro osteo.
Both.
Now, I don't know, I can't say for Melbourne. I don't know. Victoria. So I've had all three: chiro, physio, osteo, plus add fourth. I've had exercise physiology trained, and they taught us a plethora of things in terms of rehab, musculoskeletal health, pathophysiology, neurology, pharmacology, nutrition. So I'm training a lot more nutrition. I'm actually allowed to give nutrition advice based off my education. I don't even know.
No, definitely not. No.
So for me, I'd go, I don't know. I would go back and argue that to then go, are you allowed, if you said to your physio friend, can you give nutrition advice? If we went back and looked at our curriculum, I'd be allowed to give more nutrition advice than what they are.
So we can only give what's publicly available in terms of online government sites.
There's an absolute incorrect statement there. Because if someone comes in and has an inflammatory problem and they say do this exercise, and I say, actually eat this anti-inflammatory food and avoid this inflammatory food, then I've done a better job and I've done nothing chiropractic.
And probably make the patient feel better. More than we have.
And I'm trained in it. And I'm allowed to do that. So I would argue back on that. But there are definitely chiros who heed none of that advice.
Yeah.
And all they do is crack. And then I can't disagree with your friend.
And I think this is that belief system of going, chiros weren't trained in universities and they don't open a textbook. And is this what you thought, Zoe, that they didn't have the disease pathology knowledge?
I did learn in our last podcast episode that it's a university degree. I did think it was like a college-based sort of thing. I had no idea. And I guess...
Yeah.
But neither did I. I was telling people that it wasn't. Early days in my career, I was going, they're not even at uni. They don't do anything.
Yeah.
I guess my point of view, my belief system was always like it seemed a little witchy woo-woo.
Yeah.
And not really based on anything, not really evidence-based.
Evidence-based.
Yeah, because we hear that a lot, your training's not evidence-based, cracking adjustments aren't evidence-based. And
I mean, if I went and showed you, like, that you would then be throwing your own profession under the bus.
Exactly.
Because I was trained by PhD physios. This is the latest research. If I sit there and go, okay, then we're all sitting here having the most stupidest argument, which I think this is happening. I think
it is.
It's so dumb. Yeah. Because if someone says, you chiros aren't trained, I'm like, your profession is helping train us. Like,
I also think it's really, like, I don't think it's, like, as you said before, you're not going to throw another professional under the bus or another profession, like an individual or as a group.
Yeah.
But inversely, it's like, as Eve said, at the start of your career and then having other professionals throwing chiros under the bus, it's like, well... Why?
And I think that's hopefully what this does, is get to the why.
Yeah.
To round out that discussion, like, even if, say, your friend was right and they go, okay, the chiro has only got one tool and all they do is adjust and they don't do any rehab, and we go, okay, fair point, all good arguments.
Yeah.
I would say that any chiro, physio, osteo, massage, exercise physiology, any profession that doesn't do further training anyway, well, then don't go see that person.
Yeah,
like,
they're limited.
We're legally required to go do further training.
There's a reason for that.
You know what I'm like, and I'm an addict with it. Like, I don't want to go to the point of being an absolute coarse gypsy where I have to do everything. But
but that's why we value education here at MT so highly, and that we do our tutorials and we do mentoring and things to keep everyone progressing with it. It's not just maintain; it's progressing with the profession and going, do this course. Let's do this new thing.
If you come out of uni and all you've done is your degree, you're so subpar.
You're limited.
We know.
100%.
We come out like, I need to get so much better. I'm so fresh at this.
Yeah.
And we're thankful to patients that would go, hey, I'll put my trust and faith in you to go help me out.
Yeah.
And that's why we need senior practitioners or more advanced, like more mature practitioners to go, hey, this is what you could do for that patient. Great, thank you. Yeah. But like, it's, if someone didn't go do further education in rehab or in musculoskeletal health or in pathophysiology or in nutrition or whatever, like in America, you can go do a whole diplomas in further education. So they've got one for rehab, they've got one for like acupuncture, they've got one for nutrition, where you come out in this high level, educated, almost like a second degree, expansive education.
And I guess like healthcare's always developing. There's always a new way to do things and new research coming out. So if you don't develop those skills, if you don't upskill,
you're going to be left behind.
People will be doing newer things and better treatment methods, and
and that's probably something against chiros, where initially they were like, we're not doing what you're doing, we're going to stick here and do our thing. And that probably held us back. Maybe that's what made it woo-woo and witchy, because they was like, well, they're not in a stuff.
It lasted for so long. It's all right. That's the one on you.
So we're not in that. If you're not up to speed and changing with each profession, and not integrated with each profession, like as I said, like we had physios, we had osteos, we had chiros come and teach us. We had people that in other countries worked in hospitals as chiros, but in Australia we don't get to do.
And I guess it's like every profession as well. Like it's not just limited to the
absolutely
chiro, osteo, physio. If you don't develop and keep learning, you're just going to get left behind. I
mean, I worked under many physios that I remember one. I was a contractor. He was the owner of the practice, and he was sort of 40s. Patient came in, heat pack went on. Bell left next to their table. He went back to the desk, did some notes, whatever. 20 minutes, patient there, comes back, heat pack off, massage, a little bit of a stretch, and then off you go. To me, that's kind of the same as crack, 5 minutes off you go, because nothing actually happened. You didn't provide the rehab to this patient. And this is taught to us at uni. We're taught electrophysical agents, ultrasound interferential, TENS, heat pack. We actually do a heat pack tutorial at university. How to put a heat pack on someone at university for physios. Like, to me, utterly ridiculous, because we're not training how to rehab a patient. Now, you might use heat pack, but you can tell a patient to do a heat pack on themselves. It's not rocket science.
Yeah, so I mean, in the end, back to your friend's argument, like if they said, the chiro is not doing any rehab, but that chiro went, okay, you've got these joints and tissues that are stiff and need mobility, I'm going to treat them, and then I'm going to refer you on to a personal trainer, exercise physiologist, some other profession that can do it. Then what's the problem? Like, expectation met? I think probably the way to solve this would be, you would have to do like a blind dating thing. Patient, blindfold on, goes in, tells the history to the practitioner. There's a bunch of practitioners. You've got early, out of uni. You've got a couple of years, and then you've got a real mature, done it for a long time. And there's no expectation of who that profession is, what that person is. And then they just get different types of treatments, and then they just go, well, which one was which?
I would absolutely. That would sound like a reality TV show.
Yeah,
I would love that. We should definitely try and do that.
Say your friend, if she was one of the practitioners, how would she go convincing that patient that, well, I'm the person for you versus
and I'm legit, and I'm legit,
because the next practitioner might do something so obscure that you've never seen in your life, like half the stuff we see from private school, right? And then the person goes, oh my goodness, I feel amazing. It's still not job done. It's like,
not at all.
Education, now I need you to go and do this, and the avoidance of this, and now I need to do this exercise. But right then and there, it doesn't matter who wins. It's like, are you now defensive against that other profession?
And I think that we talked about it last episode as well, but the neurology of it is the reset technique, the crack, the adjustment, the needle, the massage, the whatever it is, to reset the system neurologically. Then you need to change the physiology. You need to go down and adapt the system, whether it's movement, strength, patterns, whatever it is. You've got to do something there. Otherwise, it's going to come back because you haven't changed physiology.
You got to like take away the negative. Like I use this analogy. We tend to use cars and computers a lot with patients. But I always say, like, if you've got 4 flat tires on a car, one of them is completely shredded, like it's blown apart, and the other 3 are just flat. There's no point pumping up those 3 until you fix the shredded tire. Now, in an anatomy or physiology, like that shredded tire might mean surgery. Like, we've got to be realistic and go, like, it's completely shredded. You need a surgery. And if doesn't matter what profession says, or don't worry about it, we'll just fix it. It doesn't exist. But it's take away the negative. Like, let's take away this joint function that's not working. That might mean manipulation. That might mean whatever. And then now we can address the other 3 flat tires. If you just keep hammering away at those 3 flat tires and never fix a shredded, good luck.
It's not going to work. I use the car engine, same sort of principle. Like, if you have a car that's built in 1706 and you try and put a Formula 1 engine in it, it's not going to work. So don't strengthen a pattern that is poor. Fix the pattern first and then put your engine in it. And that reset, then reinforce kind of model, then reload it, is kind of what we do here. Leading on to that, I want to sort of your perspective on, I don't want to sort of plug MT, but I can't do, but why have we got those professions within the one sort of roof, and what is the benefit of that, I guess?
Great question. One, it doesn't matter what the profession is. So if we've got all of them across the multiple clinics, then in the end, people can have a choice. So one, that's good for a healthcare model of like, you know what, like, I actually really like some of the fundamental principles that a chiro or an osteo or a physio does, so I can choose that. 2, we do have slightly different points of view in terms of where we've come from. So that could influence or help, could hinder, but it usually would help. And there are different tools that we learn at uni that all might be suitable to that person. So I might use a tool that I sit there and go, you know what, this tool is not good for you. I have a colleague next door. They're training this tool. I don't care which profession. but they're really good at this tool, they're going to be this person for you. If that works, that patient goes, man, that clinic is amazing. They've got everyone there for me.
Yeah.
So there's one that's just choice. There's options. We've got multiple tools that can all help. Now, here we train so that everyone can use each other's tools within their legalities. So that's helpful in terms of helping one another be as, comprehensive as possible. But two, we're not restricted to think that one profession has got all the answers.
Yeah.
Because we don't.
No.
Like, for someone to sit here and go, well, throw out chiro under the bus, they're no good. Physio is everything.
Yeah.
It's just as wrong as a chiro to say, you don't need physio, I've got my hands crack.
Yeah.
Both wrong.
Yeah.
So we've got options in that regard that, a person might come in and they need a certain thing right then and there, and they might need a different thing further down the track or in a different case. Or we might have someone come in that comes in for back pain, and classically they'll get referred to a chiro, and then they come in for an ACL tear and they get classically referred to physio.
Yeah.
We're in the healthcare model that it's like, it doesn't matter which.
Yeah.
Now we have people that specialize because they do more.
Yeah.
So like, if someone comes into ACL rehab for me, I'll send them to you. Because I'm like, Ethan does them
I just do
all
more.
the time.
Yeah.
You do them all the time. Like,
Yeah.
see Ethan.
Yeah.
Like, why would
Even
you
though
not?
you've ruptured an ACL.
Yeah,
You know exactly what it is.
But we've got expertise in certain fields. I'm like, go to this guy. They're going to be, well, they're a physio. And? Doesn't matter.
Doesn't matter.
Like, they're here because they know what your body needs.
Yeah.
Oh, okay.
Yeah.
Now, that's us getting over the patient's fear and, their knowledge and expectations.
Yeah.
And sometimes it doesn't work. People are like, nah, I'm doing chiro. I'm sticking with you. I'm going, okay, this is not a chiro thing.
Yeah.
But okay.
Yeah. I'll do my best, but I'm probably limited.
Yeah.
As long as you know that, expectations met.
And speaking of expectations, like I used to work for a guy that his name was in his name of his practice.
Yeah.
And I remember talking to him a lot about this. I've heard lots of people say, like, you have big businesses in America and they do the same thing. And as soon as your name is on the door or on the brand name, patients want to see that name.
Yeah.
So if they come in and they see Darby Therapy, Andrew Therapy, whatever, they go, I'm going to see him.
Yeah.
So we've deliberately put it where there's no one's name and there's not one profession.
Yeah.
Because if someone came in and said, I need to see physio.
Yeah.
Sorry, there's no physio available, but there's a chiro right there.
Yeah.
No.
Yeah.
It says it right there. So that's part of it.
Yeah, sure.
We also, our name is telling us what we're looking at. Like we focus on movement.
Sure.
Meaning musculoskeletal health.
Yeah.
We are deliberately trying to address people's health and function, move communities to a better, healthier life through exercise, through movement, rather than just come in and get cracked.
Yeah.
There's lots of clinics that it's like sports physiotherapy. It's like, well, does that mean you don't do
the elderly
pelvic health?
Yeah.
You don't do elderly?
Yeah.
Like, there's lots of spine and gym.
Yeah.
For whatever. It's like, do you only treat the spine? Like you sometimes.
Absolutely.
So we're definitely not inclusive to certain things. We're not exclusive to other things. It's like we're inclusive to all.
I think the one thing I noticed working here as well, different to any other clinic that I've been in, is that we don't charge a higher fee for our senior therapists.
Oh yeah.
So anyone that, say yourself who's 20 plus years in the profession and Adam is 4, say, it's they're charged the same. And it's because we both bring the same value in terms of expertise. And if Adam thinks that he is, out of scope or what have you, then he's got you to refer to, and the patient doesn't have a barrier to see you or me or whoever, because of that.
One of my mentors in the States, Charlie Weingroff, he says, you should believe that you are the absolute right person to treat this person.
Yeah.
You are the right man or woman for the job.
Yeah.
If you don't believe that, why are you treating them?
100%.
They should be referred on.
Absolutely. Yeah.
So like if someone comes into me, I'm like, I'm the guy. And if I don't believe I'm the guy, I'm like, okay, I've got to work out who I send you to.
Yeah.
And if you don't believe that, it's like, well, you're going to be referring all your patients out because you don't believe that you treat them.
Yeah.
Like,
or you'll keep them and they won't get better.
Yeah, right. So like you should utterly believe. Now that means you have to now go and educate.
Yeah.
You have to
You've
learn.
There's a responsibility with that. Isn't it?
You have to do that. But you want to absolutely go, I'm the right person for the job. I solely believe that I'm the right person for you.
Yeah. Love it. Would you go and see chiro now?
I think it depends on what I need to do.
Okay.
And I also think...
So what's the depends?
Yeah.
Because that's a good question. Like that, it's a good answer, I should say. Because classically, people go, I see a chiro for bones, and I see a physio for muscles.
Yeah. I don't know, actually, because I've seen you for neck pain and that sort of thing, which is what you would commonly... But I guess then it's also when would you...
And that was that because we already had a prior friendship, and it was you knew me, and that sort of fear was broken down already. And what's the...
Well, I guess when would you let me go see a chiro?
Go see a chiro tomorrow.
Will you let me?
Oh, Darcy, I've seen one other physio in the same clinic, our clinic still, and I still hear about it.
You have a real patient practitioner value belief, and you want to stick to that person.
Yeah, I mean, I've seen...
Stick to Ethan, right?
Yeah, I've seen Eth since I started playing footy for years. Yeah, he was sports trainer my first game when I broke my finger, and then it just...
So that's the thing you want.
There.
You want that.
It's the connection
I've got my
that we've
guy,
built.
girl, whatever. I've got my person, and it doesn't matter what profession they're in.
Yeah.
If that profession doesn't have the answer for that particular case in that particular time, we should be in a healthy mindset to go, I'm going to send to the right person.
Yeah, I think if I was to go in and see you and you were to say, oh, I don't know about this, or not, I don't know about this, but like I think Darth would be better suited to fix it. I'd be like, okay, sure.
Yeah. So that's the thing. Like your friend you were talking about before, if they were stuck with a patient and they're going, okay, I've got, like you said, they were booked out, couldn't see it. It's like, well, I would see to this person. It's like, well, why would you not send to that? You cannot do that based off your own beliefs. Absolutely. Because then that's not evidence-based care. Yeah. It's the exact opposite. Yeah. And I would push back on someone who says, oh, well, the evidence says, it's like, well, actually, you don't even know the evidence that this person's doing. Yeah. You have no idea what that practitioner's doing. So go and test that out. If someone said to me, what do you believe about this therapist? I'm like, I don't even know. Part of me is like, I want to go to an acupuncturist to experience this. I want to go to a nutritionist to see this. I want to go to a podiatrist to experience. Like, you want to know? Yeah. We send to people who we know what they do. We go spend time with them and go, hey, we've got a patient for a foot thing that needs to be addressed, so we're going to send to Tim down the road.
I think that's really powerful. There was a patient who I've been treating for 7 years at the moment, and there was a point in my sort of rehab with her was I'm not getting anything out of this patient. Like I'm stuck. I'm at a crossroads. I was still pretty early in my career, so I went to a few courses run by an osteo, and I reached out to this osteo and said, hey, can I bring this patient to you? Can I come and I want to learn and see what you do, and if you do anything differently, I want to actually take that and move my practice. And then I came working here, and I gave it to you, and I said, look, can just give me a second pair of eyes, and can I come and look at you? And then I did the same with EP. And I said, hey, Luke, can you actually have a look at this patient and see if I'm missing something here? But the difference is I think I came with the patient, and I wanted to go, okay, because I think she really trusts me, like you said, Zoe. I've been treating her for years. So there's the trust there to go, look, I'm not just sending you off because I can't be bothered or because I don't think I can. It's going, I know I can, but I need more tools, and I want to learn from different professions that have different lenses to be able to go, we're going to do this together.
And I think it's like a patient, if I'm there and you're saying, I want to learn more from other people, that's such like a positive thing as well. Because I'd be like, okay, well, you want to be able to do your job better, and you want to be able to learn more and continue developing, and that's...
And we're both working for you. Like our goal is you. Like that's the benefit of going 100%. And that comes back to the main theme of what we talked about at uni, was the patient comes first, and make sure the patient's always at the center of your care.
Which is why we don't care who you see. In terms of movement therapy, it doesn't matter within reason. Whether it's a chiro, physio, osteo, EP, as long as it's patient-centered. As long as the patient is coming first. You know what? You could see all of them as long as we're all in the same model, which is why we work out our education to say, hey guys, we're all on the same path. We're all on the same lens to look at you, the person, the patient, as what needs to be treated, cared for.
Love it.
I feel like we could talk about this forever.
We
could be here all day.
We do.
100%.
This is still ongoing, right? It's a couple hundred years.
100%. What's one myth?
I think it's probably that. It's the people come in and go, physios just treat muscles. And chiros just crack bones. Cracking a bone is a fracture, so you've got to be careful with what we say there.
And I think that's what I was taught historically. Chiros are bones, physios normally are exercise, and osteos are the Reiki specialists. That's kind of what we...
Yeah, and that's, I think, as a physio, as a profession, you guys have gone, you know what? Like, people come to us for exercise.
Yep.
There's a whole profession called exercise physiology that specializes in that.
Absolutely.
And so I think the physio world's gone, we actually have to do a better job at either working out how we treat rehab or we have to put ourselves in a particular position to go, this is what we do as a profession. Because if someone came to most physios and said, well, what do you do? Like, what is it that you do? What would be your answer?
Oh, geez, it's
hard.
Yeah,
Right?
it's such a hard question.
If someone comes to me and says, what do you do? My thing is, it's not, I do chiropractic, I do exercise, I treat function.
Mine, I would say I rehab patients.
Okay. So do you do that by exercise or do you do that by manual therapy?
Depends what they need.
Exactly. So like if you pigeonhole, you go, well, they just do muscles.
Yeah.
What happens if that person has a joint restriction that now is not allowing their muscles to actually create excursion to allow function?
Yeah.
So it's not my patient anymore. No? Yes, it is.
Yeah.
You have to treat the joint. Oh, but physio don't treat joints. Oh, since when? But this is why it's such a dumb argument. And that's a myth that I'd love to go. Because back to, we talked about our curriculum, the amount of physiology, musculoskeletal, so musculoskeletal, muscles and
bones,
skeleton. It's both. Like, we don't just do skeletal and you just do musculo. Like, it's dumb. Like, it's so silly.
Yeah.
But that's a myth out there I think we need to change.
Awesome.
Because if someone comes in and says, well, I'm going to come to you for crack and I'm going to go to Ethan for rub. Right, this is silly. But like, if that's the expectation and they go, you know what? You're really good at crack and joints stuff and Ethan's really good at mobilizing my muscles. That's what I'm going to stick to. I'm like, okay, like we could do a better thing here, but that's fine if that's why you want to play it.
Yeah.
But I think that's a myth. We have to get that out
awesome.
And
hopefully this podcast has done it.
Yeah,
that would be over the 2 episodes.
I'd
have
love
a look
to see
at
if there's questions. Like,
it'd be. I just want a big sort of forum of people, like Q&A session of just smashing it back and forth. But like Zoe said, we talk about it forever. Really appreciate your time again, Darth. Thanks so much for that. I think we could go for episodes and episodes on this, but hopefully we've broken it down. Any sort of questions or information you want extra, head to our website. We've got blogs. You can email us directly if you have any questions or make a comment on Spotify or Apple, whichever one you listen to. But listen back to all the other episodes. Listen back to part 1 of the Chiro series. That's a really good breakdown of what the profession actually is. And till next time, Darth, thanks so much.
My pleasure. Love orangutans.